This is one of those situations where it is a capital cost, but in comparison to getting more sets, which isn't going to happen, this is a minor cost in order to process things in a timely fashion so that you can utilize your staff to do more recording and different things that they will need to do during these times. The organization is going to have to be restructured as we know it from the past in order to accomplish and handle the sheer volumes that they're going to have in terms of what's going to come through the door.
Every day, they slay the dragons of healthcare-acquired infections and dangerous microbial fire breathers. While you may not see them during your next hospital stay, they will be there ensuring the safest possible surgeries by skillfully wielding their disinfecting weapons of mass microbial destruction. They are sterile processing professionals. And this is Beyond Clean, the central nexus for the people, processes, and products that are pushing the global sterile processing industry forward. Join us every week as we introduce you to the unsung heroes, leaders, and innovators who are fighting dirty around the globe. And now, it's time to go Beyond Clean.
So, Bob, I'm excited for this one, and there's been so much talk about COVID response and dealing with the pandemic, but we are starting to hear a lot more conversation about facilities resuming elective procedures, especially in light of some AORN guidelines that was in a partnership with 4 other industry organizations that went out on April 17th. CMS had a similarly timed communication. And so as we see this begin to resume, we know hospitals' revenues have been down. They're going to have to work to recover some of that revenue. And Chuck's got some ideas about what might help facilities and ambulatory surgery centers recover.
Yeah, I'm really looking forward to hearing their perspective on how their product can assist facilities with this. We know it's going to be a big deal. We just don't know really what the impact is going to be, but any product that's out there that can help these surgery centers, these hospitals, be more efficient and handle these increased patient loads better is nothing but good. And I'm looking forward to hearing Chuck talk about it tonight.
You're listening to Beyond Clean, the global voice of sterile processing.
Joining us now is Chuck Kemp, President of Education for IST One Tray, and a very timely topic because, Chuck, we're going to be talking about how facilities can prepare for the return of elective procedures post-COVID-19 pandemic. It's great to talk to you again. Thanks for coming on the show today.
Well, thank you very much, Justin. Appreciate it, and look forward to talking about the EZ-TRAX and One Tray system.
So let's talk about the state of the market. And I know you're in constant contact with your customers, especially as the president of education. Doesn't matter if we're in the middle of a pandemic and staying home, there are always educational needs that need to be met. What are your customers saying to you today?
It's interesting because over the last month and a half now, I'd say we've been still doing some in-services, both mostly video conferencing kind of things. We stopped traveling the first week of April. But we've been talking to the ASCs, and I've been talking to my educational team as well, speaks to the ASCs as well as the clients that they deal with in terms of hospitals. And we've been talking to them and trying to discuss what our opportunities are, where they need help, and what's going on. What we've heard so far from ASCs as well as hospitals is simply this, that they're concerned because the backlog they have now sitting in the wings waiting to come in, which is similar to what we were looking for when we started One Tray EZ-TRAX, because we knew everybody was picking up with the ASCs, especially with the orthopedic side. So we were kind of prepared, and that's what the whole concept behind One Tray EZ-TRAX was.
And Chuck, it kind of feels like this was a problem already prior to the pandemic. It just feels like now the problem could potentially become much greater because hospitals are in a state of revenue loss that they're going to need to recover from.
No question about that. But I think what you're seeing more so is the fact that this has been a problem that's been oncoming. Everybody's getting backed up. We have less sets or the same amount of sets, and we're trying to do more surgeries. So this is where we play into everybody's hand in terms of assisting with that application in order to facilitate what the OR, the SPD, as well as the surgeons need to be efficient and effective during the day's work so they can get as much in as they can in the time frame they have, and especially after this pandemic when we have so many people trying to get back in to get those elective surgeries taken care of.
Yeah, it really does heighten the struggle, doesn't it? So tell us, why do you think that the One Tray and EZ-TRAX products are going to be such a great help as they face this challenge?
Well, the reality is that this tray, one tray I'm speaking about, is considered a casket essentially in this industry. And what that means to us in the industry is it's the outside container that everything goes and gets sterilized from. The EZ-TRAX system, though, is something a little bit unique and different. And what it does is it actually allows us to take sets that are typically 6 trays, 7 trays, and move them down to about 3 trays. Because of the way it fits in the one tray, or if you were to wrap it, you could do either one, but we suggest the one tray just because of the time efficiency that one tray brings to the table. Between all of that, you're going to find that this is going to speed up your processes. Your patient safety is still going to be there, which is imperative. And most importantly, it's going to help from every aspect, from the OR, for the surgeon, setting up your back table, taking your back table down, as well as the sterilization piece. We can't really do a lot about decontamination, but we can definitely expedite the sterilization piece.
Well, that's great, Chuck. Tell us about how One Tray EZ-TRAX will help with this onslaught of the surgical volume that's going to be coming on us here very shortly.
Well, it's ironic that this happened the way it has, and it's sad at the same time, obviously. But what we found is we were already looking for the next piece of the puzzle to make sure that the ASCs could keep up with the amount of surgeries already moving over to them from the hospitals. With that being the case, we know that the struggles coming out of this with the case volume they're going to have is going to be unbelievably tough for especially an ASC to handle. With that being our situation, and with our tray and our EZ-TRAX, the two together, the One Tray and EZ-TRAX, you're going to find that you're going to be able to do sets in facilities, operate in less time. In other words, the surgery itself that's typically taking you X time, we're able to reduce all of that. But in most cases, it's about 25% of the time it is currently to do what you are doing currently. So what we're looking at is a 25% time. So therefore, you're saving 3/4 of the time. It also is going to expedite in the OR, putting the instruments back into the tray, sending them back to decontam and have them cleaned and taken back. Remember, we're never going to get more and more sets at each hospital. We're going to have what we had and have to work with that and get that done and try to accomplish more cases in a day's time. Also, let's be honest, hours of the day are going to extend for a while till we get caught up from the backlog that they have. And we might even be working weekends to take care of this as well. So this is a whole big planning process that people are looking at right now. And like I said, I've talked to quite a few people in the industry, and they're all getting ready to set everything back the way it was. But they do realize that backlog of cases is going to come quick and come hard.
Yeah, that's really a big deal, Chuck. I'm just thinking back to my days when I was scrubbing in the operating room as a surgical technologist and doing orthopedic cases. And I can't imagine what it would be like to have 3 trays as opposed to 9 or even more if we were doing a revision or something. So you're saving not only time, you're saving dollars. You know, there are studies out there now that saying OR minute is $150. So if you're saving 5 minutes per case, you can really start adding up that dollar total for the hospital, but also the time that the technician is using to break down the set, sending it to decontam, the sterile processing technicians putting it back together quickly, being able to sterilize it more quickly and getting it back. This is really a big deal.
No, I would agree, Bob. This is a situation where what we've been able to do and accomplish with this product between the two of them is expedite things, continue the safety for patients, and at the same time with the EZ-TRAX, reduce the sets down to the limited number, which is even more imperative in the ASC because their autoclaves only being the size they are, it's allowing you to do a whole case instead of having to tie up an autoclave for 2 hours to do one case because of the amount of trays you had in the past. So we really do see this as a benefit for every which way you can go as you look through this process from the SPD to the OR to the surgeon himself and then back through decontam and do it all over again. You'll be able to utilize those sets more times in a day by utilizing this equipment.
You know, and you mentioned the fact that surgery schedules demands are going to be so high, right? It might not only be long days, but it could be on the weekends. But you mentioned the financial impact. And unless there's going to be a great deal of return on a purchase, you're not going to see these budgets opening up to add any kind of inventory to meet that increased surgical volume. So if you were already pressed for the number of containers and your ability to sterilize those trays, and then all of a sudden you have an increased demand and you need to buy more product, the money's not going to be there. So they're going to be investing in products that are going to help reduce the overall cost and implications for the system, I would think.
Absolutely. This is one of those situations where it is a capital cost, but in comparison to getting more sets, which isn't going to happen, this is a minor cost in order to process things in a timely fashion so that you can utilize your staff to do more recording and different things that they will need to do during these times. The organization is going to have to be restructured as we know it from the past in order to accomplish and handle the sheer volumes that they're going to have in terms of what's going to come through the door.
Yeah, Chuck, I was just sitting here thinking about the infection prevention piece of it as well. This is a really big deal. So you've got these sets inside containers. So you're not going to be seeing holes in blue wrappers, and you're not going to be dealing with wet sets and things like that. But the ability for staff to focus on fewer trays actually allows them to really focus and to clean them better, to make sure that they're in the proper working condition as well.
No question of that, Bob. And the reality is with this tray, you're able to process it quicker, more efficient, much faster. But at the same time, with the tray itself, there's a full warranty on the one tray. So the lifetime warranty. So as you said, when damaged trays come out, and they do, take the tray out of play, send it back, we'll take care of it. The other thing I would mention that you're not going to have a torn or wet wrap. You're not going to have any delayed cases. All of those pieces of the puzzle truly add up during the course of a day, because it seems like by the second surgery of every day, something had a torn wrap or a wet wrap or something went wrong or went awry. Once it does, the whole day goes in the toilet, so to say, and the next thing you got to do is try to keep it going through. With the one tray product, where we've utilized it in many facilities, along with the EZ-TRAX inside it, we have found that the efficiencies and the fact that there are no delay OR times, and everybody, including the surgeon, is completely satisfied with the time frames that it is actually working in.
Yeah, that's a huge deal. I also think back to all of the audits that I do when I go into hospitals or assessments. When I go into a facility that's doing 5 or more total joints in a day, I'll often ask the technician what corners are they cutting to get the product back to the operating room in a timely manner. And they look at me like I'm crazy, but they understand that I have been where they were, and that I know they have to cut corners to get those sets back to the operating room. It's just not possible, like you said, with the way that a standard total knee or a total hip or even a revision, it takes up so much time and effort and energy and equipment just to turn that stuff around. So this is really a neat thing.
Yeah, and something I'll add to that, Bob, is we did a time-lapse study that is unbelievably done, and quite frankly, it indicates exactly what the one-tray EZ-TRAX system will do versus a wrapped container. By doing it that way, though, it's a time-lapse study that goes through from decontamination all the way through the process, through the surgery, et cetera. You'll see, and I would go on onetray.com in order to take a look at that, because it's a very interesting piece, and quite frankly, it really paints the picture that we're trying to paint here.
Yeah, I got to see that video, and it was all over LinkedIn. Very nice job on that. And I think I've seen some testimonials as well. One from a Dr. Marchand that said something about being able to process 8 to 9 knees in one day versus 4. So as you do increase those surgical volumes, it also sounded like he was getting home to his family a lot sooner too.
He's an interesting story because Dr. Marchand's been with us for quite some time now, and quite frankly, was a huge early on developer of helping us take this product to another level. He personally has found himself working his 7 to 5 day now and being home at 5:30 in the evening instead of what used to be some days 7:30, 8 o'clock at night. And he's actually been able to add a couple surgeries every day and still do it in the less time frame. So the efficiencies in that time study definitely shows it, as well as the fact that what Dr. Marchand does in his testimonial, and as well as Dr. Taha talks about the utilization of the one tray as well. You can see by these testimonials that these surgeons are seeing this as a huge uptick for them in terms of being able to be efficient and at the same time effective. And quite frankly, let's be honest, it is about money. By the time they pay for this, it's nothing in comparison to trying to get more sets in a facility. So it's a minuscule cost to actually save OR time, transition of turning it over in the OR from taking it to the back table, from the back table back in the containers and back down to decontam, and then throwing it through the sterilization process. The whole process, though, is amazing if you watch that time-lapse study, or even, like you said, listen to those videos that those two doctors are on there.
Yeah, Chuck, I can tell you that this gaining efficiency in the operating room is going to be just a huge deal. Like you said, we're certainly here and they're there to take care of patients. But at the end of the day, they're a business and they want to make money as well. So having the opportunity for a scrub technician or a scrub nurse to be able to break down the back table in half the time, to clean the room, to start the turnover, to get ready for the next procedure. It is really going to be an impactful situation that you're setting up for them. And it's something, just hearing the talk about Dr. Marchand and being able to go home early, everyone wants to do that in the operating room. The days can be long and they're challenging and they're stressful. You're doing surgery on a human being and you want everything to go perfectly. So this is really exciting news.
It's honestly interesting to me too, Bob, because as we look in the industry, and I've been to quite a few facilities across the country, from hospitals to ASCs, et cetera, and the bottom line is all of them have their own problems and their own concerns, and the way they do things a little different than others, and I get all that. But what I've learned from surgeons is I have surgeons that I've seen out there that will use a 6 or 8 tray system, which is taking forever to wrap 45 trays to do the amount of sets they have to do in a day's time. What I have learned, though, there's a lot of doctors that have said, take that stuff and get it down to 2 or 3 trays, and it's lumped in one tray, basically a basket, a wire basket, that they bring in, and then the tech has to then separate everything back on the OR table, on the back table, which takes a half hour in some cases, and then another 20 minutes at the end of the case to put it back in, to get it washed and then re-sterilized and sent back up, which that process is typically taking about 3.5, 4 hours. So by the time we do what we do with the tray, EZ-TRAX, and the 1 tray outside container, we can actually take that system and do it in about 1 hour and 20 minutes. I think that's the piece that definitely is indication where we can go and where this industry can help itself down the road.
So, Chuck, here's another thing that's always been very interesting from the sterile processing perspective. And it's one thing when it's hospital-owned inventory and you have those doctor-specific sets, Dr. Smith, or they're like, wait a second, it's not that different than the standard major basic or minor basic. So why do we have this specific set? But in vendor managed inventory, it's going to be incredibly difficult to eliminate those doctor specific trays. And that's really how that all is coming about, right? Is the reason they have so many sets is they have the standard set and anything that they might possibly need, but then they need all their personal customizations as well. And there's a feature that I learned about your EZ-TRAX very recently where you have this QR identification, and especially for ambulatory surgery centers that don't have a tracking system, that could be a huge benefit. Can you just give a quick general overview of how that works?
Sure, and I agree with you. That was one of the reasons we put it on, because ASCs typically don't have an automated system. So what this does is you actually take a phone, it's a QR code, you zap it, and it's doctor specific. So if it's a Dr. Smith, here's what Dr. Smith's stuff. Basically, it's a recipe of what he has in there, as well as pictures. So it shows exactly how it should be setting in the tray. At the same time, it shows you exactly what the items are and the part numbers. So if something was missing or broken, you could order another piece. So we found that to be very helpful in the fact that it's a very generic way, but a very easy way to take everyone's sets for each specific doctor and identify exactly what they need and where they need it and how they do it. At the same time, in that QR code, we have all the instruction for use. We have all of the important pieces that you would ever need to know about the set itself as well. But it definitely helps because we can do it doctor specific and break it out per doc, what he uses or doesn't use during his surgeries for those sets or for that knee or hip or whatever it might be.
That's fantastic to have all of that information at really the touch of a button. So when you're thinking about this entire system that you have, who all do you think it's going to help?
That's an interesting question. And I'll be honest with you, at this point, I've seen as many hospitals, if not more hospitals, than necessarily ASCs at this point. I really think it's a no-brainer for ASCs, and especially coming out of this pandemic, because they were transitioning to do more and more, but all of a sudden now it's today. People are going to want to go to the ASC. They're not going to want to go to hospitals just because patients are going to want to be as safe as they can. I think initially you're going to find that's the push. They're all going to go to the ASCs. By doing such, this is an opportunity for ASCs to be able to keep up with that workflow, process things the way they need to, and hopefully, like you said earlier, keep the days back to normal, even though we're doing more cases, as opposed to working until 9 o'clock every night and working every weekend. I think this is an opportunity for them. But what we've seen with Dr. Marchand, Dr. Taha, they're hospital facilities that they're working at. And quite frankly, it works fantastic for both of those men. They absolutely love it. You must sit down and take a minute and look at their videos, because I was super impressed with the comments and conversations that were had on. And I think there's more than that. It's hospitals, it's AFCs, it's the vendor, it's the surgeon, It's definitely, without question, the patient themselves, your SPD, your OR, and quite frankly, your administrative staff, just due to the fact that the cost that you're not going to be wasting as much money waiting on trays that a wet wrap, a torn wrap, a delayed case coming up from downstairs from the SPD. Those kind of things go away, and the fact that the OR can then take it to the back table and take it out of the room as quick. I just wanted to add that piece in because it's a bigger encompassing puzzle than we realize when we talk about these two products together, because they really affect and are creating so much efficiency in every facility.
Great. So tell me how you think this will impact the patient.
It's interesting you say that, but in my opinion, let's be honest. If a patient can be in the facility or in the OR for less time, that's a good thing because they're under anesthetic less time. If the surgery can be quicker and more efficient and more effective, there's no wait time. How many times you see a patient run into a room and they're waiting for an hour for the equipment to get upstairs? Once things get bogged down in central sterile, it typically stays that way all day long. This will eliminate a lot of those problems. And at the same time, as it eliminates it, and we can set the back table as quick as we can and tear it, all that process makes it so much more effective and efficient, not only for the facility, not only for the doc and everybody else, but what about the patient? If you're only in that room for 45 minutes instead of 2.5 hours, obviously that's a good thing, not a bad thing.
Yeah, from a safety perspective in anesthesia, that's a great opportunity. I was just thinking from my own personal perspective and having surgery before, being NPO or not being able to eat after midnight. So if I'm the second or third case of the day, instead of having to wait to have surgery until noon or 2 or 3 o'clock, I'm having it earlier, meaning I'm waking up earlier and actually getting to eat sooner. So, I think it could help patients from that perspective too. So do you think this will have much of an impact on the sales reps and distributors?
I actually do, only because they're all looking for better ways to do things too. Because like I said, they're not getting more sets. During the course of a day, they're going to have at that facility 2, 3 sets, whatever it might be. So they have to turn it over as fast as they can. Currently, that process is about 4 hours. With that being said, this gives them an opportunity to turn it over quicker, faster, and just as efficient, and gives you the same time frame in the OR, because let's be honest, the quicker they're in and out of the OR, like you said, your schedule gets moved up instead of back. Because I've been that guy that had to wait till 5 o'clock for a surgery. And as big a man as I am, and Bob, that food's important to both of us. So waiting that long in a day is a very tough situation. But to be able to get out and get in recovery and get back into your room and get in and out of these facilities, because a lot of these facilities, basically what we're seeing nowadays is simply you're in for a day and you're gone. You're not staying overnight. In a lot of these cases, they're not staying overnight. With that being said, how much nicer would it be to be able to come out of the anesthetic and get yourself back on your feet and get out of the building as quick as possible?
Chuck, I appreciate you not including me in the food's important to me comment, but at the same time, I think it's because I'm 5'9".
That was a good point.
So, Chuck, it's interesting because you're kind of talking about how the fact that you have two different customers, because they're both invested in efficiency. You have the hospital or the ASC, the healthcare provider customer, but then you also have the vendor distributor customer who's also looking for similar efficiencies and cost savings. I mean, 8 sets shipping that is going to cost more than shipping 2 to 3 sets. So that's a big deal. So Chuck, you've educated us quite a bit on your products, but also the types of problems that they solve for the healthcare industry. How can prospective customers, as our listeners are hearing this Vendor Spotlight podcast today, how would they then engage you to get more information?
Well, let me first say thank you. And then I also want to add the fact that when you talk about our education team, it's bigger than what people realize. We don't have reps in the field going out and training people. We actually have a team that's been educated virtually through the whole process from A to Z about sterilization, about A to Z how these trays work. And every study that's been involved, they've seen, touched, and understand. And they're able to help because of all the facilities that they've also been to effectively help every individual look at what best practices might be for them in terms of utilizing the tray and or the EZ-TRAX. This is not for everybody for every case. This is for specific uses. With that being the case, the easiest way to get a hold of my education team and myself is simply using the phone and calling us at 937-619-0138. That's 937-619-0138. You can discuss and ask for myself or someone from the education team. We would love to help you out in any way. We're also doing a lot of things and have been even during this pandemic. We've been doing a lot of things with video conferencing, and that seems to be the way right now because people aren't being able to get in and out of hospital. But we've done in-services. We've done some planning with other folks during this time. Obviously, it's slowed down, but we have still been able to accomplish that, and we would more than happy to do that. And lastly, I'll say, as soon as it's possible, we'd love to get out there, let you see the product, feel the product, understand how the product works, see it work, and it makes this whole process so much easier. So we look forward to however we can help anybody. Please give us a call. We're looking forward to talking to you soon.
All right. Yeah, that website is onetray.com. And I'll just add, you can email them info@onetray.com. They'll send you brochures, video testimonial links, documentation. Make sure to check them out on Facebook, LinkedIn, and a YouTube page that has all of those testimonials that Chuck just mentioned. And Chuck, I just want to thank you so much for coming on. You're a great guest, great information, and I really do hope that many of our listeners will reach out to you to learn more.
Much appreciated, and thanks to you and Bob. And I look forward to talking to you guys soon and look forward to talking to folks that are interested in the OneTray EZ-TRAX system.
That was Chuck Kemp, President of Education for IST OneTray. And obviously, we talked about the EZ-TRAX system as well. I've had a chance to see these products in person, Bob, and obviously we met the team several months ago, also in person for the recording of Beyond the Tour. But Chuck is such an engaging personality, and I don't want to do a spoiler for Beyond the Tour, but little did you know, you've known Chuck your whole life, but I could see why he's in the role that he's in, because he is passionate. He really knows the information, and he's very clear on how this can help.
Yeah, you can absolutely see that he 100% believes in this product, in the impact that it can have on physicians, on patients, on sales reps, on facilities, on sterile processing departments. So it's really, really cool to listen to him talk because, like you said, the passion just oozes out while he's talking about their product.
All right, that's going to do it for this vendor spotlight. As a reminder, you can help support Beyond Clean by subscribing on iTunes, Stitcher, Google Play, and Spotify. Make sure you visit the IST OneTray YouTube page as well for all those time-lapse videos and testimonials. We'd appreciate a rating and a review because your feedback is important to the show. And if you have any topics that you'd like us to cover on a future episode, just send an email to info@beyondclean.net. On behalf of Bob and myself, thank you for listening to this vendor spotlight on Beyond Clean.